Hi, it's Dr. Phyllis Hayes Reams, and this episode of Redemptive Brilliance I am calling Hospice and Palliative Care is a calling and not an assignment. I couldn't get away with letting March in without giving a special shout out and say happy Social Work Month to my sister social workers. Thank you for everything that you do in serving in hospice and palliative care. Also, March marks just about the time that I heard God tell me that He wanted me to work in hospice and palliative care. I had worked for years in geriatric medicine, worked in the nursing homes, helped start our cognitive disorders clinic at my medical center, did some home care, but mostly it was skilled nursing facilities and then clinic. My father passed away in November, actually on my birthday in 2002, and it was life-changing. I had experienced deaths in our family, grandparents, my aunt, who I was named after. Even with that, when my father passed, it was something indescribable. Even as a physician, one side of my brain is understanding his cancer diagnosis. The other side of my brain is the daughter and praying and hoping that he will get better. Being his hands-on caregiver during the last days of his life, as I took over caregiving duties, initially at night to help my mom, and then I would provide the full-time care on the weekend. That left an indelible mark as well. And it was that next year in 2003 that God told me, Phyllis, I want you to start serving me in this way. Now understand, I would have never, ever thought I would be working in hospice and palliative care. When I finished my training and knew it was time to get what we call a real job, right? I was very happy doing nursing home care and then doing geriatric assessment care. I thought I had hit my destination, but we know that God has His own purpose and plan. And now I can realize how He just was prepping me for where I was going. And by then I'd already answered the call to ministry and was ordained in the Methodist denomination, the African Methodist Episcopal denomination. I feel so blessed and humbled to do this work. And now this is what I do predominantly. I love doing interdisciplinary care as part of a team, working with my sister nurses and my sister social workers, home health aides, chaplains, other physicians. Now, I want you to understand something. I am not devaluing or negating the value of our men who work in this field. And as a woman who's also a wife, a mother, a sister, an aunt, a friend, a niece, a community volunteer, there's something special about us women and all the different roles that we play. And I really don't know that it's a matter of wearing different hats that I used to say, because do you really take off one hat before you put the other one on? It's really more or less learning to set boundaries and prioritizing and really trying to be present where you are in that moment. And that's not always easy. And doing this work, serving in this capacity, doing hospice and palliative care is not for the faint of heart. People are in a potential crisis seasons of their life. They've been given some not so great news. They may have been healthy and functional, and over the matter of months, and weeks, their body seems to rebel against them. Families are in crisis. And I truly believe that regardless that the number of COVID cases may be going up and down, the impact it has had on the psychosocial environment and atmosphere of our world has not stopped. People are still very much on crisis and in crisis mode. And it has become even amplified more in the area that we work in with hospice and palliative care. And we're also human beings. So we also have our lives, and we continue to give. And we haven't stopped. That's the big thing. We haven't stopped. During COVID, we still continue to show up every day to see our patients. And we prayed that we would be safe, that if we were exposed and were infected with COVID, that we'd get over it, that we wouldn't pass away from it, that we would be able to continue to work and provide for our families. And some of us did get sick. And we donned on our PPD and PPE, I'm saying PPE, and kept going. I can speak for myself. I would say a little prayer and say, Lord, I'm here to serve. And you never know what you're going to meet when you get into someone's home, because there were some, especially at the very beginning, and even now, who they, feel they don't need to wear masks. And especially at the beginning, we go in the house all donned with our PPE, and there were people who didn't have masks on. And sometimes we could go into the home where there were multiple family members, because of course the patient was declining and they're there to surround and support each other. And we would have to go in. And a lot. It just was very impactful. And then to get home and go from there and pick up and show up for our families and in our other roles in the community. But again, such a blessing and such humble work. As I said, I would not have known to be assigned. I don't think anyone gets assigned to do hospice and palliative care. They truly have to have that calling and that heart to serve, and to be able to regroup and go back in the ring, as I say, to just love upon people and to give and to answer questions and to be the shoulder to cry on. And that's why I am dedicated to make sure that in any way that I can, that I'm here to support our community of those who work in hospice and palliative care, so that we can set the appropriate boundaries so we can continue to thrive. Because hospice and palliative care is how we serve, and it's what we do, but it's not all there is to who God has created us for. We have to be able to thrive. We have to continually reconnect with our why we're doing it. And as I stated, to be able to set those boundaries so that we can live our life with passion and purpose and to be all that we're created to be. So I want you to know I see you. I value you. I look forward to seeing you again. And don't forget to hit that subscribe button down below and invite your friends. Let's build this nation of faith-based, healthcare, heart-focused women who work in hospice and palliative care. Let's build this nation, the nation, our community, our tribe, so that we can come together and share together and keep each other uplifted and growing so that we can continue to thrive and do the work we love to do. Until next time, keep shining diamonds, keep shining diamonds. Take care. Bye-bye.